screen now. So kia ora koutou to those who are joining us virtually. I've been in this role nearly 5 months, and today, 5 months ago, I had my pulpiri into the role, into the ministry, and that was a wonderful occasion. And one of the comments I made is that I feel a huge weight of expectation on my shoulders in a whole range of ways, but that's okay. We should have high expectations. I don't mind other people's expectations on me, and we should have high expectations of ourselves, and we should have high expectations and ambitions for our health system and for health in Aotearoa, New Zealand. And equally, I feel with that weight of expectation, the support and the friendship and the collegiality of many across the health community to support me going into that role, and to support the many good people I can tell you who work in the Ministry of Health. And just this morning, just before I came here, I was meeting with the advisor in the Department of Prime Minister and Cabinet who works on health, and she has for some time. And she specifically commented, unprompted from me, but I want to share it, about how good our tobacco control team is in the ministry, how responsive they are, and how optimistic they are and positive they are, and how they're always ready to provide very good advice. So I do want to acknowledge that team, and Brendan's here. And Brendan, we've worked for many years together. I think I was your boss many years ago directly. Now I'm indirectly still your boss, and you're working in a great team. So many of you will be familiar with the government's overall priorities. And one of those key priorities is child wellbeing, improving child wellbeing. And of course, one of the key things we can do, not just to improve child wellbeing, child and whānau wellbeing, but also to address inequities in child wellbeing and child health outcomes, is to address tobacco. So this has got to be a major focus for us and for the government. And I'm happy to say that it is right on the radar. Just to rehearse for you the Minister's other priorities, child wellbeing being one of them, and that's a very strong cross-government priority led out by the Prime Minister. Primary healthcare, mental health and addiction, and also, and possibly not surprising for a Labour Minister of Health, a strong publicly funded healthcare system. So that's a major priority for him. And within that, as has been mentioned, tobacco control is an important priority. And we have an arrangement where Minister Clark is the overall Minister of Health and Associate Minister Jenny Salesa as the delegation for tobacco control. And I meet with her weekly, as I do with Minister Clark, and not a meeting goes by when we're not discussing this topic. And she is personally very committed, and many of you may know her and her background in public health. We worked out that many years ago in the late 90s, we probably sat near each other in North Health, which was the Northern RHA, if any of you have a memory that goes back that far. So she knows health, she knows health inequities, she knows public health, and she knows the impact that tobacco has on all those things, and so she's deeply committed to them. One of the things I did want to mention, and it's directly pertinent to some of the issues that have been mentioned already, smoking in cars is a good example. We are lucky enough to live in a country with MMP. And I say that because I genuinely believe that, and I believe that MMP is an excellent system of government. But what it means, of course, as we have now got used to, is it means coalition arrangements in our governments. And so the extent to which progress can be made on any issue is directly proportionate to the extent which that coalition government can get support across the coalition partners. And I'm sure it doesn't take me to point out to you that we have quite different coalition partners with quite different constituents and quite different priorities. So there is quite a difference in a number of key policy areas, not just within health, between the Greens on one hand, probably the left hand, and New Zealand First on the other hand, with, of course, that large party, Labour, in the middle. So, this is the thing about MMP, and in fact, one of the things I like about MMP is that for every bit of legislation and for every decision, you have to have the numbers. And that makes for good democracy, but it also can make for frustration at times, because often things will not progress unless there are those numbers, and a number of factors will impact on whether or not the numbers happen to be there at any point in time. Now, windows open quite quickly, and in fact, we've seen a possibility of the window around banning smoking in cars, or possibly banning smoking in cars. We've seen that window open in the last week with a comment by the Deputy Prime Minister. And so where we stand as a ministry is, of course, ready, and just to emphasise how ready our team is, with a whole range of very good advice, ready to take those opportunities when they come up. So there's a window that may be opening, and we'll be ready to support pushing the window open further to let in more fresh air in children's lives. So I just wanted you to keep that in mind. I have a few other comments I want to make. First of all, and I've alluded to this, the potential for reducing smoking amongst Māori is a way to close the gap between Māori and non-Māori, to address inequities. The potential is still very significant, and this has to be a major focus for us. You'll be aware of, and it's been alluded to, our ministers, and in fact this government's commitment to equity. And if you hear the minister speak, he will say, the reason I got into politics was to improve or enhance equity. It is a key driver for him. So for those of us from a public health background, when you've got a minister who's leading out with that, and then you look at his list of priorities, it's like a dream list. And our job is to support him to make progress in that. To support that, one of the initiatives we've been doing over the last year or two, predated my time in there, is, and some of you may well be involved in some work to pilot some different ways of supporting young Māori women to quit smoking. And probably the best day, and I'm sorry for those of you who are there at the launch of the Health Coalition on Wednesday night, because I'm going to repeat this story, but it bears repeating. The best day since I started in the role, and I can tell you every day is a great day, but the greatest day was going and listening to the presentations, or at least one of the presentations, back to the ministry and others on those pilots. And the one that I heard, and it was a pilot done in South Auckland, in Manukau, with a relatively small group of young Māori women, 18 to 25, I think they were, 8 or 9 of them who embarked on this program. And the hook-in, very, very carefully and thoughtfully done, the hook-in was to help them quit smoking. Now, it was an 8-week program, and just to hear the description of these young women's lives, what they had been through in their time, both individually and collectively, was profoundly moving. The huge disadvantage, really, and the huge issues they had to deal with already in their life. And, you know, one of the key things that had to be thought about to engage and support these women in the program was childcare. Between the 8 or 9 of them, they had 32 young children. And this was one of the most enabling things to allow them to then be able to participate in the program. So what was wonderful about this presentation was watching the profound change in the lives of these women over the 8-week period. And yes, they gave up smoking, but that was incidental. What really happened was they got their lives back, because through the program, they had an opportunity to make connections, to develop a group of peers who could support each other. They had the opportunity to learn about and try different vaping products in a safe way. They had the opportunity to learn about and start to manage their alcohol and other drug consumption, to learn about nutrition. They had an opportunity to be physically active and go kayaking together. And just to give you an example of what changed for them in that 8 weeks, at the start of the program, not one of the women could name one person, including their partner, who might be interested in coming to their graduation 8 weeks later. However, of course, by the end of it, they all had incredible support from their whānau, from friends, and of course from each other. So the reason I'm raising this example is because the way forward, of course, for addressing the very issues helping people to stop smoking and, of course, preventing starting. The way forward, and one we need to embrace and be much cleverer about, is ensuring our initiatives from the research through to program design through to implementation are far more grounded in the experience of people's daily lives. And this involves us working across and not thinking just about individual risk factors. And Richard mentioned I worked at the WHO, and the whole approach around non-communicable disease prevention and control is embedded in the 4 common risk factors, of which tobacco is one, and the 4 disease areas. We need to be much more integrated in our approach to responding and to therefore making progress from here. And no group is this more important than for Māori. So I'll just put that weirdo out to you, one that we're trying to, we've picked up and we're trying to progress in the ministry. And I would also just like to give a plug for one of those ministers' priorities, and that's mental health and addiction. And you will know the impact that tobacco has on the physical and mental health of people with mental health conditions, particularly those with more severe mental health conditions. And so this has to be something, this has to be a group that we embrace and work much more closely with in our research and in our programs to help support them to quit smoking. So we've talked a little bit about smoke-free cars. We're making progress on legislation, moving towards legislation around improving access to vaping products. They're under active consideration, and we're expecting some announcements soon, so watch that space. So yeah, I'm optimistic. For those of you who know me, that wouldn't surprise you, but I am as optimistic as I've ever been about the progress we might make. And again, just I want to emphasise as a closing comment, the importance of being ready when that window opens, of keeping up the research, of keeping up the advocacy, of thinking about the nuance of coalition arrangements in your advocacy, and just how you support the different partners that are part of the government. And don't confine yourselves, and I'm sure you won't, to those government partners. But we also have in our largest opposition party, a party that has shown an appetite for quite strong measures around tobacco control, and there's no reason to think that will have changed. There has been profound cross-party support for quite significant tobacco control measures in the past, and so I'd encourage you to keep the dialogue going with opposition parties as well, perhaps with the exception of the one-member party that's somewhere out here. Okay, but it's always worth trying, never give up hope. Yeah, just in closing, thank you for your work. It's a great pleasure to be here, again, looking around the room at many familiar faces. I really appreciate the contribution you are all making to continuing us on this journey, this important journey, and to making progress towards Smoke-Free 2025. We should hold a very high expectation on ourselves, on our politicians, and on our country that we will achieve this, because this is a goal, this is an aspiration that is worth aiming for. We know that as a country we will be better off in so many ways if we achieve it. So stick to your guns. Nō reira, tēnā koutou, kia ora koutou katoa. So we've got 10 minutes or so for questions. Oh, wow. That was quick. Not wasting any time there. Good.
Kia ora, Ashley. It's really nice to see you back. We had a big old kani at one of the Smoke-Free conferences, and I know you'll remember me. It's okay.
Of course.
So I come from, I'm from Blenheim, and I work for Te Piki Oranga, which is a Māori health provider, and I work on the ground providing cessation support for people. So I have 2 questions. One is, when we submit our reports to the MRH and we put our NHI numbers in, somehow or other they revert back to European, and 80 to 85% of our clientele are Māori. If we put the ethnicity down as Māori, and it somehow, I don't know what happens to it, but it goes to the ministry, and apparently at birth, if the parents haven't put the ethnicity down properly, it'll revert back to European. So it skews our numbers, and we're not happy about that because most of our people that we deliver services to are Māori. We're a Māori health provider, and we like our numbers to look correct. So that's an issue for us, NHI numbers. And the second question is there going to be some funding for vaping devices? Because, man, no one's really interested in patches, gum or lozenges anymore. Everybody wants a vape. Kia ora.
Kia ora. Good questions. Brendan, can you look into that first one? Thanks, mate. We'll follow that up. I mean, that just seems really odd. So we'll have a look and find out what's happening there. I think this is a really good question to ask about access to vaping devices. I think getting the legislation through will be the first one. And we just need to be innovative around how we might do this. So from my perspective, I'm open to us. The ambition here is to support people to quit smoking. The concern around access to vaping, of course, has been about young people taking it up who otherwise wouldn't have. And I think that's a legitimate and an important concern. And the legislation should support, should help prevent that happening. However, we should also, and a drive in the legislation is to increase the availability and awareness of vaping devices and the value that they can have for some smokers in helping them quit, and the potential significant reduction in harm from switching from smoked tobacco to vaping. So look, I'm very happy that I've got an open mind and we'll look at it. And if you guys have got good ideas and research that can help inform good policy in this area, we're very open to it. Kia ora.
Kia ora, Ashley. Ko mihi Blair. Talking where I work at Hāpai Te Hauora. I'm the General Manager for the National Tobacco Control Advocacy Service. Like you, I'm new in the sector, in the health system. Well, you've been there forever, but I'm new. However, my question is, you mentioned you had a statement where you said strong measures towards tobacco control. Could you, having a look at that as a government, could you give me one example of what a strong measure looks like for the government?
Yeah, so one of the areas that we're providing advice on, and which I think is, in a sense, a next frontier around tobacco control, is composition of tobacco. And so there are, and regulation around that. And I think one of the avenues that's worth exploring is nicotine content. And I can tell you that I've already personally had a discussion with the Minister. We've provided a range, as part of a range of options that we've put up. And again, these are conversations that happen regularly. So we're keeping these options foremost in her mind. And for my thinking, I think this is an area that is worth exploring. And if we get a signal that the government's open to us developing up some policy around that, we'll be ready to move in that direction. So I think, again, there are two frontiers. One is that I think need to be opened up, to use the Star Trek analogy. One is around content, and one is around availability. So I can tell you both those areas we have already and will continue to present options to ministers around how they might progress those areas.
Oh, kia ora.
Kia ora.
How are you? Kia ora. So Sue Taylor, TNT Consulting, ex-Totu Manawa Māori, ex-Te Reo Māori. The question is, carrying on from Brenda, in regards to vaping, and just wondering in regards to the ministry and the government, how do they reconcile the use of vaping in regards to the product when tobacco industry is involved in vaping? And so how do we're on one hand, we're saying we're not interested in their product, tobacco product, but on the other hand, we're saying we're interested in their vaping product. So how do we reconcile that as a country and as a ministry and as the Crown? So kia ora.
Kia ora te mā koe, Sue. Nice to see you again. It's great. This is one of the challenges, isn't it, in public policy. Issues of public policy get there because they're not black and white. There are grey areas. And so my approach to these things is we must always keep our eyes firmly focused on what is the outcome we're seeking, And there are many areas of public policy, and we're grappling with one, for example, at the moment around synthetic cannabis, where there are no great options. There are probably not even any good options. There are several okay options, and they all carry with them risks. So yes, there is a risk, and it is one of the things that bothers me. It bothers me if the tobacco companies are getting into the market around vaping and smokeless tobacco products. It bothers me a lot because their track record is not flashed, would be euphemistic. So saying, if I had a choice of vaping and smokeless tobacco products provided by the tobacco industry and tobacco products manufactured by the tobacco industry, I think on balance, I'm happy to go with the former if it is helping support the outcome we're after, which is reducing tobacco-related harm. So, yeah, these are exactly the issues we have to grapple with and keep a really close eye on what is happening and ensure that we're putting in place legislation in the first place. We are being thoughtful about how we regulate very strongly to avoid any unintended consequences.
Kia ora. Kia ora, Ashley. You don't know me, but I met you at the project and the presentation for the Wahine Māori project that we did at the beginning of the year or in the middle of the year. And yeah, you're absolutely right. The Auckland-based project was fantastic, and they had an awesome presentation for the wahine that they worked with for that project. And unfortunately, you left before our presentation, and it was equally awesome.
So I heard.
Yeah. But there was diversity in all of those presentations, I believe, that day, and there was one common theme, and that was having a holistic approach with those wahine that we worked with, as well as all other smoking whānau in the country. I think that's Te Ara Whānau Ora. For us, Whānau Ora was one big one that came out that day. The other one was with the smoke-free cars. I think for the Ministry of Health, I think you just need to get on with it. If you ask 99% of our smoking whānau, they would tell you that they don't smoke in their cars with their kids. So, you know, I don't know where the hold up there is, but I think just do it. You'll get 1% that may, you know, kick up a stink, but the rest of the smoking population will probably go with it really, really well. So, kia ora.
Kia ora.
Don't have to comment, sweet.
Yeah. Nice to see you again, and I'm so sorry I missed your presentation on the day, but I know they were all, you all had similar outcomes to present. And again, just to emphasise around the smoke-free cars, we've just given great advice to the Minister. With a window open, we were ready to go with it, and it includes the information about the extent of public support, including from smokers. It's in there. So we're ready to go, and again, it's the art of the possible that is politics, that is the last barrier to work our way through. But let's, you know, keep up the advocacy, keep up the support.
Tēnā koe, Ashley. It's nice to have you back. My question's around innovation. What I find amazing about innovation is everybody wants you to be innovative, but then they want you to prove what your project is before you actually do it. So how can it be innovative? So my question to you is, how brave are the ministry to actually place funding on what hasn't been proven and let some of the services just get on with trying some things? Because I think on the ground for Stop Smoking Services, being brave is really hard because there's the whip at the strap's waiting if you don't get it right kind of thing.
Strap, gosh. That brings back some memories. Fortunately, memories that my boys will never have. Yeah, look, I think this is the tension in the way that ministries, including our ministry and the District Health Board's contract services, and we need to move much more into a commissioning approach. I think the work we were doing with the pilots is trying to move into that approach. You know, an action learning approach. It's then how we then translate that if we scale it up into a contract and how that codifies, what the expectations are so that we can see what's being delivered, which we all want to and need to report on. So there's that. I think the other aspect of this is, so a commissioning approach, which focuses on what is the outcome we're seeking, how do we provide a more integrated approach, and someone mentioned the whānau ora approach. I think that's exactly right. But what we do have now is we do, through the whānau ora collectors, have some experience in how you do effectively commission for these broader outcomes. So I think there are some lessons for us to learn, and you'll be pleased to know John Tamahiri, who's never backward in coming forward, has offered to meet with us and talk about the work they do and see how we can link up with them. And also I think there are some lessons for us to learn from their experience with commissioning.